Female contraceptive. Contraception, birth control, prevents pregnancy by interfering with the normal process of ovulation, fertilization, and implantation. There are different kinds of birth control that act at different points in the process. Take a look at this contraception methods chart. Do you see anything that does not belong? How does a contraceptive work? Most types of contraceptives work by A. Preventing an egg from being released every month, hormonal method. B. Preventing sperm from reaching the egg, barrier, and some IUD methods. C. Blocking the reproductive function in men or women, sterilization method. D. Preventing a fertilized egg from implanting in the uterus, hormonal method. Contraception methods for her. The pill, emergency contraception, the female condom, the cervical cap, the diaphragm, the vaginal ring, the intrauterine device, the contraceptive implant, the contraceptive sponge, spermicides. Contraceptive injections, the contraceptive patch, sterilization, natural family planning, coitus interruptus, lactation, amenorrhea method, symptoms-based method. The pill. The birth control pill, also called the pill, is a daily pill that contains hormones to change the way the body works and prevent pregnancy. Hormones are a chemical substance that control the functioning of the body's organs. In this case, the hormones in the pill control the ovaries and the uterus. Emergency contraception. Plan B. Emergency contraception exists to stop you from getting pregnant if you have had unprotected sex. This method is for one-off occasion and is not recommended for daily use. It is particularly useful if a condom breaks or if you missed one of your contraceptive pills. The most common brand of the morning after pill is Levono. You should take it ideally within 24 hours after unprotected sex. This offers over 95% protection. The longer you wait, the less effective it will be. After 72 hours, 3 days, the effectiveness drops below 50%. If you vomit within 3 hours after taking the pill, you must take another one. The female condom. Just like the male condom, the female condom is one of the few types of contraceptions that you can buy over the counter at pharmacies and grocery stores without a prescription. It was first introduced 20 years ago and offers 95% effective protection for pregnancy, as well as some protection against STIs. Female condoms are generally more expensive than the male ones, but they are less likely to burst. They can be inserted up to 8 hours before sex. The cervical cap. The cervical cap, sold as FemCap, is a thimble-shaped latex cup, basically like a diaphragm, but smaller. It also needs to be used with a spermicide. The cervical cap must remain in the vagina at least 6 hours after sex, but it also has to be taken out within 48 hours after sex because some women get cystitis or bladder infection from using a diaphragm. The cervical cap is a useful replacement because it has less contact with the vagina. It only covers the cervix. The problem with types of contraceptives, such as the FemCap or the diaphragm, is that their effectiveness is 92 to 95% protection. This is much lower than other types that are 98 to 99%, and they are only partial protection against STIs. No HIV protection. The diaphragm. The contraceptive diaphragm is placed inside the vagina so that it prevents the sperm from getting into the uterus. Despite being a barrier method, it doesn't protect against STIs. The diaphragm must be coated with spermicide each time before sex, and a doctor needs to show you how to use it. You need a prescription to get one. It is inserted at least 6 hours before sex and it needs to be removed after 24 hours for cleaning. Depending on the material and type of diaphragm, it can be reused many times. The vaginal ring. The vaginal contraceptive ring is a small, transparent plastic ring that is inserted in the vagina and kept in for 3 weeks. You should then remove it during your periods and replace it with a new one after that. The ring contains the same hormones as the contraceptive pill, progesterone and estrogen, therefore providing the same kind of effective protection and side effects. You will need your doctor's prescription to buy the ring. Just like other hormonal contraception, the vaginal ring does not protect from STIs. The intrauterine device, also known as an IUD. You have a choice between two types of IUDs, hormonal or copper-based devices. Hormonal and copper IUDs are part of a few long-term solutions, meaning that you can keep them inside the vagina for up to 5 or 10 years. The effectiveness rate for IUDs is above 99%. However, they provide no protection against STIs. Note that IUDs can be a form of emergency contraception if the device is inserted within 5 days after unprotected sex. You will nonetheless need to visit a doctor to have it properly inserted and follow the prescription. A few follow-ups and check-ins for the first few weeks. Contraceptive implant. The contraceptive implant is another option among the types of contraceptives that offer long-term protection. It lasts for about 3 years on average. Just like IUDs, the implant does not protect against STIs. The contraceptive implant contains progestin, progesterone, the same hormone as the contraceptive pill. The hormone is released into your body at a steady, slow pace for 3 years, producing the same effect as the pill. The implant is inserted in the arm by a healthcare specialist and must be removed after 3 years. Since the risk of human mistake is ruled out, the implant has a much higher effective rate than the pill, around 99.99%. Contraceptive sponge. The sponge is a small, round-shaped foam, polyurethane, placed deep inside the vagina. It contains spermicide so that sperm does not get past the foam. You should leave the sponge inside the vagina for at least 6 hours after sex, but remove it within 24 hours following sexual intercourse to lessen the risk of toxic shock syndrome. The sponge does not protect past 24 hours and does not provide any STI protection. It is sometimes used as a backup for other contraception methods when you forget to take the pill, and you can buy it without a prescription from the pharmacy. Spermicide. Spermicide is a recurrent ingredient in contraceptions because it proves very effective when used in combination with other methods like the diaphragm or sponge. In itself, spermicide does not always offer the best protection against pregnancy, although this is also due to inconsistent use of the product. You do not need a prescription to buy spermicide, and it has very few associated side effects, but keep in mind that it does not protect against STIs. Contraceptive injections. This method dates back to the 60s with the invention of artificial progesterone. One shot of hormones lasts in the body for 8 to 12 weeks and has the same effect as the pill. Injectable contraceptives are about 99% effective, with pregnancy occurring mostly with women who forgot to renew their contraceptive shot in time. Once the shot is given, it cannot be reversed, so you are effectively infertile for the next 3 months. Just like the contraceptive pill, contraceptive injections do not protect from STIs. The contraceptive patch. The contraceptive patch is exactly the same thing as the contraceptive pill, but in the form of a patch. It provides the same effective protection against pregnancy and has side effects, positive and negative. It does not protect from STIs. You wear the patch for 3 weeks. Take it off for 1 week, allowing your menstrual cycle. Then you start with a new patch. The patch allows you to have no need to think about taking the pill every day. Sterilization. Sterilization is an option available to both men and women. As far as male contraception is concerned, the technique is called vasectomy and consists in tying off and cutting the tubes that carry sperm. Without the need for a scalpel intervention or stitches, the man can then go home in the same day. This provides no protection against STIs, and the effects are for life. In very rare cases, less than 1%, the tubes can grow back, making pregnancy a risk. As for female sterilization, this is also a very simple operation, after which you can go home on the very same day. You have the choice between surgical and non-surgical types of sterilization. Surgical sterilization, known as tubal ligation, requires very small cuts in the belly to across the fallopian tubes. They cut them and tie them so that they cannot link the ovaries with the uterus anymore. The effects are permanent, so you must be sure of your choice concerning sterilization. Non-surgical sterilization consists of placing a coil in each fallopian tube through the vagina and uterus, eventually blocking each tube completely. The scars may take up to 3 months to completely block the tubes, so you need to use another method of contraception in the meantime. Both options also offer more than 99% of protection against pregnancy because of rare cases where blocked tubes happen to grow back and reconnect. That's 1 in 200 women. Natural family planning. Although not a device or a pill, this is still a method of contraception. Natural family planning relies on knowing the menstrual cycle so that couples avoid having sex when the woman is fertile. There are 3 techniques: basal body temperature, cervical mucus, and rhythm calendar method. They all can be used for this, with higher protection rates when all 3 methods are used in combination. The effectiveness of this type of contraceptive varies between 75% to 99%, but 85% on average, with the higher uncertainty due to the fact that most women do not have a perfectly regular menstrual cycle. Coitus interruptus, the withdrawal or rhythm method. One of the oldest forms of birth control. Approximately 35 million couples rely on the withdrawal method for birth control worldwide. Keep in mind that even if a man pulls out in time, pregnancy can still happen. Pre-ejaculation can pick up enough sperm left in the urethra from a previous ejaculation to cause pregnancy. To prevent this, a man can urinate between ejaculations before having sex again, and it will help clear the urethra of sperm, increasing the effectiveness of withdrawal. Pregnancy is also possible if semen or pre-ejaculation touches the vulva. While not the most effective form, it is certainly a very natural birth control option. If done correctly, it has a 73% to 96% effectiveness rate. Lactational amenorrhea method. After we give birth, most women don't get their period till at least 2 months postpartum. However, if a woman is exclusively breastfeeding her child, it can be much longer until her menses returns. The condition is called lactational amenorrhea, and it can be used as a natural form of birth control. However, in order for this method to work, the breastfeeding woman must 1. Not have had a period since giving birth. 2. Her baby must be 6 months or younger. 3. She must nurse her child exclusively. 4. And nurse at least every 4 hours during the day and go no longer than 6 hours without nursing during the night. If you have all of these conditions met, you can use this as a form of short-term birth control. Keep in mind, like all of these other birth control methods presented here, nothing is 100% effective except complete abstinence. Some women ovulate before they get their period, so there's a vulnerable window where pregnancy can occur.